Earlier this week, we had the spectacle of new Health Secretary, Mr. Irreversible, there's no going back, Sajid Javid, a man with an attitude of, if you get COVID, just walk it off. A chap with all the empathy and bedside manners of Skeletor, sat on a train to Cumbria saying he's off to open one of 48 new hospitals. Except he wasn't. The whole opening new hospital shtick that the Tories have been whittering about for a long time now has always failed to materialise. And even the additional Nightingale hospitals, open to deal with increases due to COVID, were a scam with no additional staff to run them. They were a political stunt, nothing more. Sadly, PR is more important to this shambles running the country than actually running the country. And so Javid's stunt was readily exposed by doctors at the very hospital Javid was heading for, a hospital that has very much existed for the last 20 years. What Javid was off to open was a new unit, a new cancer unit, state of the art, yes, a great thing for the hospital, yes, and if they'd been honest about it, would have reflected well on the Tories. But instead they went with the enormous fib that it's a brand new hospital. Worse, when the lie got exposed, people will naturally have dug down into the detail, and it was quickly picked up on by left-wing Labour MP John Trickett that the unit was actually ordered in 2017, so actually had nothing to do with Johnson or his team whatsoever. Trouble is, this is just one example of a very dishonest set of claims regarding new hospitals. Hospitals who have had their layouts changed, had a unit replaced, had a refurb, been merged, are all being called new hospitals when that is anything but the truth. And most damningly, the government is demanding the NHS implicate itself in this lie by backing the government up and saying they are new hospitals too. They've issued guidance on it, a playbook they call it. Spin, if ever there was. Now, the guidance demands that, and I quote, the schemes named in the announcement are not all identical and vary across a number of factors. However, they do all satisfy the criteria we set of what a new hospital is, and so must always be referred to as a new hospital. Now, there is a paragraph doing some exceptionally heavy lifting. They vary across a number of factors. Yes, they do. They are all changes to existing hospitals, but therefore still not new hospitals. They satisfy the criteria we set of what a new hospital is. Well, what criteria is this then? The criteria of, we promised in our manifesto that we'd build 48 new hospitals by the end of the decade. And of course, we lied about that. We are Tories after all. So let's try and spin our way out of this one. That is essentially what this all is, an exercise in spin to make it look like they're doing something they actually aren't. And as for the criteria, well, here you are. Here's a box of plasters. Let's call it a new hospital, shall we? Here's a tubular bandage, another brand new hospital. Here's some hearing aid batteries, another new hospital there. And look, I've got the makings of my very own NHS trust in my living room. This is literally as honest as any of the claims the Tories have just made. And the saddest part of it is they're getting away with it because this story has been woefully unreported because most of our mainstream media, particularly the right-wing rags that tend to support the Tories, have not picked it up. Once more, it is small alternative media outlets mostly exposing this. The thing is, for all these supposed new hospitals, many have seen bed reductions. Where mergers have taken place, services across the board have been reduced. 2 hospitals have become 1. Our health service capacity has been reduced over 11 years of Tory rule, and it's all happened at the worst possible time. A report out today, published via the Lancet Infectious Diseases Medical Journal, so not Tory spin, but proper scientific research, has shown you're twice as likely to be hospitalised by the Delta COVID variant than the original Alpha strain. We're already seeing cases of COVID rise, particularly in places where schools have already returned and where there have been large gatherings. Newquay, for example, here in Cornwall, is riddled with COVID right now. Some 5,000 cases off the back of the Boardmasters Festival. Deaths are already back above 100 a day nationally, and apparently Johnson considers 1,000 deaths a week an acceptable number to keep the country open. How sick can you be? How sick of him to put a value on human life like that? You can bet he wouldn't value his own as such. If one of these 1,000 deaths a week was a member of your family, would you consider their death to be good for the economy, for the betterment of the country, a price worth paying? The vast majority of schools haven't even gone back yet. The government has put no mitigations in place in them, despite them being shut for weeks. And of course, none of these children are vaccinated, so you know what is going to happen next. If you voted for the Tories on the back of their promise to build 48 new hospitals, if the NHS is something that was important to you at the time, then you were lied to. They want the NHS gone. The pandemic is giving them cover to do it, since the additional strain the NHS is under excuses their claims that it is unfit for purpose in this day and age. Fact is, they've underfunded it, under-equipped it, and understaffed it for 11 years. And just as we may all need it most, it's at its lowest ebb. It's what the Tories always do. The NHS has never and will never be safe in their hands. So stop voting for them if you value your health service.